You're listening to RazorCast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.
Hello, everyone. This is Liz Harvey, coming to you from our studios in New York City, where we are dedicated to bringing you top-quality advice from many of the leading expert professionals across the U.S. In today's episode, we are speaking with Dr. Igor Kaplansky. Dr. Kaplansky is the founder of Dentistry by Dr. Kaplansky in Gasport, New York. He grew up in Russia, and after receiving his dental degree, he was accepted into the International Dentist Program at the University at Buffalo School of Dental Medicine. He graduated cum laude in 1998 with a Doctor of Dental Surgery degree and continued as a resident in the Advanced General Dentistry Program at Buffalo. Since 1999, Dr. Kaplansky has been practicing family dentistry with a special interest in orthodontics and dental implants. He has been recognized with prestigious fellowship awards from the Academy of General Dentistry and the International Congress of Oral Implantologists. Dr. Kaplansky is widely considered to be one of the top dentists in the country, and he is also a contributing member of our National Network of Industry Professionals. Today we're going to talk about a very important topic, bridges and crowns. Hi, Dr. Kaplansky. How are you today?
Hi, Liz. How are you?
I'm great. Thanks for joining me. So, what are the main reasons that people need dental crowns?
There's different reasons why a tooth would require a crown. We'll start with simple ones like, say, a lot of decay. So when the tooth gets a small cavity, it can be filled with a filling. When the cavity is larger, it becomes just mechanically very weak, the tooth, and then we move on to what's called a full coverage restoration or a crown. The crown covers and protects the tooth and acts as a brace, sort of, so it doesn't allow the tooth to flex underneath. And that would extends the life of this tooth. So cavity is one reason why the tooth would need a crown. A crack in the tooth would be another reason why a tooth may need a crown. Same thing, once the tooth develops a crack, if tooth is not covered, that crack will continue to spread, and it sometimes can go through the pulp and cause pain, or it can split the tooth and lead to a tooth extraction. So a crown then protects the tooth and extends the life of the tooth. And then last but not least is a cosmetic reason. Crowns a lot of times done to correct shape or color or position even of teeth in the arch. If orthodontics is not feasible, we can use dental crowns to correct misaligned teeth or discolored teeth.
And what is the process for getting a crown?
It's very simple. It usually involves 2 visits or 2 appointments. There's new technology out there where it sometimes can be done in 1 visit, but a traditional approach is on the first visit, the tooth is prepared to a certain shape. Impression is taken, and that impression is sent to the lab. The patient receives a temporary crown, which usually lasts for about 2 to 3 weeks, and then 2-3 weeks later they come back and we replace their temporary crown with their definitive crown.
And can you describe what a typical dental bridge looks like and how it works?
It may be difficult to describe it, but I can try. A bridge is basically like a bridge across the river. There's 2 abutments, usually on both sides of the space, and the tooth in the middle is called a pontic, and that is what actually replaces the missing tooth. So bridges are done to replace missing teeth. On both sides of the space, teeth are prepared as if they would be prepared for crowns, and then a 1-unit restoration is made that is literally bridging this gap. It spans from one tooth on one side of the space to the other tooth, all in one piece, usually made of either all ceramic material or porcelain fused to metal where there's a metal understructure and porcelain baked on top of it. And that structure gets cemented over the teeth, over the supporting teeth, and it stays in there permanently. It's just like a crown. It doesn't come out, and it replaces the missing teeth.
And is it possible to have more than one false tooth on a dental bridge?
Absolutely. Bridges can replace single tooth or multiple teeth, and depending on how many abutment or supporting teeth we select, sometimes bridge can replace a full arch of teeth. Say on 4 or 5 abutments or more, we could replace up to 10 or more teeth.
And lastly, why would someone choose a dental bridge over a permanent dental implant?
That's a great question. Implants have displaced bridges from dentistry over the last few years for obvious reasons. They're just a better option. Bridges traditionally have been done for years because there really were no other options for fixed tooth replacement where teeth wouldn't be removable. So bridge was the only fixed option for many, many decades. But since dental implants came into existence, they slowly pushed the bridges out, and but there's still situations when bridges are feasible and indicated. One reason would be insufficient bone volume to place an implant. So if the patient doesn't have enough bone, bridge can still be used if they have healthy supporting teeth. Financial reasons sometimes play a role. Bridges may be more affordable. Cosmetics also play a big role. Sometimes it is easier to create a pleasant smile with a bridge versus an implant. These would be the reasons.
Great. Well, thank you so much, Dr. Kaplansky. We know you're extremely busy, so I just want to thank you for your time and help today.
Thank you for having me.
And for our listeners across the country, if you are interested in speaking with Dr. Igor Kaplansky, you can either go online to www.drkaplansky.com or call 716-772-7500 to schedule an appointment. And on behalf of our entire team, we want to thank you for listening, and we look forward to bringing you more top-quality content from our country's leading industry professionals.
You've been listening to RazorCast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.